today to have Karen Cross with us. We've got Democrats on our panel here today, believe me. Karen served as West Virginians for Life Executive Director. She has spoken at National Right to Life conventions, Rally for Life 90, and numerous universities and colleges. She has testified before the West Virginia legislature and has successfully lobbied to pass a partial birth abortion ban, a Women's Right to Know Act, and an Unborn Victims of Violence Act. Her presentation at an international conference on abortion in Poland in June of 2004 was recently published as a chapter in the book Abortion, Causes, Ramifications, Therapy. She currently serves on the National Right to Life Committee Board as an at-large member and as an advisory board member for Labor of Love, a maternity home and crisis pregnancy center. Karen is married and has 3 children and 1 grandson, Jamison. And I know President Obama keeps saying that, we're bearing false witness, there's nothing about abortion in this bill being paid for, but I don't think Karen would be here today if that was the truth. So, thank you very much, Karen, for being here with us.
If I listen to Nancy Pelosi, Harry Reid, and NBC, I should be frightened to be here with you, but I'm not. I'm encouraged as I look into your concerned faces. Because a small group of people working together for a common goal can change the world. Or a huge group. Right. I'm going to address 3 concerns that we at National Right to Life have in the bills that are backed by the White House. First, concerns about abortion expansion and government-funded abortion, concerns about future rationing of life-saving care, and concerns about end-of-life issues. And regardless of your position on abortion, we do know that back in November of 2008, Gallup did a poll and found 69% of people oppose government-funded abortion. We know that there are now about 1.2 million abortions every single year in the United States that they want to pay for with our government funds. So both of the bills backed by the Obama White House, Senator Kennedy's bill and H.R. 3200 in the House, would create a massive new federal health insurance plan called the Public Plan or Public Option. Both bills contain provisions that would result in the Public Plan covering all elective abortions. Under the Senate bill, the Kennedy bill, the Public Plan would be required to cover all essential benefits. The bill says that essential benefits include, but are not limited to, ambulatory patient services, hospitalization, and preventive services. Under numerous past federal court decisions, such broad categories will include elective abortion unless Congress adds an explicit exclusion for abortion. But the majority of Democrats on the Senate Health, Education, Labor, and Pensions Committee voted down such an exclusion offered by Senator Enzi. Thus, under the Kennedy bill, many private health plans would also be required to pay for and to provide local access to these essential benefits. And state laws that regulate abortion could be invalidated. On July 30th, the House Energy and Commerce Committee added to H.R. 3200 an amendment written by staff to Chairman Henry Waxman and offered by Representative Lois Katz, both of whom have consistently pro-abortion voting records. This phony compromise explicitly authorizes the public plan to cover all abortions. This would drastically change long-standing federal policy. This means that any citizen who wants to take advantage of the public plan will be compelled to purchase coverage for abortion on demand. The federal agency will collect the premium money, receive bills from abortionists, and send the abortionists payment checks from a federal treasury account. It is a sham to pretend that this does not constitute funding of abortion. If this passes, the federal government will be running a nationwide abortion-on-demand insurance plan. The House bill also empowers the Federal Health Choices Commissioner to insist that health networks provide local access to specific services. Think abortion. Both the Kennedy bill and H.R. 3200 also create a massive new federal program to provide subsidies to help tens of millions of Americans buy health insurance. The Kennedy bill's essential benefits mechanism would ensure that virtually all plans, public and private, cover elective abortion, and the new federal subsidies would flow to these plans. Under H.R. 3200, as amended by the CAPS Amendment, some private plans may elect not to include abortion, but private plans that cover elective abortion will be federally subsidized. Both bills provide funds for the new premium subsidy program through a new funding pipeline that would not be subject to the Hyde Amendment, which is merely a year-to-year provision that currently prevents federal funding of abortions in the Medicaid program. As the Associated Press accurately reported in its August 5, 2009 analysis, quote, a law called the Hyde Amendment applies to the abortion restrictions to Medicaid. The Obama-backed health overhaul would create a stream of federal funding not covered by the restrictions, end quote. In 3 House committees and in the Senate committee, pro-abortion Democratic committee chairmen and majorities voted down amendments to keep elective abortion out of the public plan and voted down amendments that would prevent federal subsidies from going to private plans that cover elective abortion. Now, in a conference call with supporters on Wednesday, President Obama said that it is a fabrication to say that the legislation backed by the White House would result in government funding of abortions, and that this is untrue. The following comment is, I'm going to read to you so that I'm accurate, may be attributed to Douglas Johnson, the Legislative Director for National Right to Life, who, and this is his statement. Emboldened by the recent demonstrated superficiality of some organs of the news media, President Obama brazenly misrepresented the abortion-related component of the health care legislation that his congressional allies and staff have crafted. As amended by the House Energy and Commerce Committee on July 30, the Capps-Waxman Amendment, the bill backed by the White House, H.R. 3200, explicitly authorizes the government plan to cover all elective abortions. Obama apparently seeks to hide behind a technical distinction between tax funds and government-collected premiums. But these are merely 2 types of public funds collected and spent by government agencies. The Obama-backed legislation makes it explicitly clear that no citizen would be allowed to enroll in the government plan unless he or she is willing to give the federal agency an extra amount calculated to cover the cost of all elective abortions. This would not be optional. The abortionists would bill the federal government and would be paid by the federal government. These are public funds, and this is